Hello and welcome to Telesur. I'm Doris following Quito, and this is from the South. In the middle of a pandemic that has so far infected over 160,000 people in the U.S. and killed close to 3,000, President Donald Trump has announced that the nation's Southern Command will bolster its presence in the Western Hemisphere, with an increased number of warships and troops to be stationed near Venezuela. Now, this comes a week after the U.S. charged Venezuelan President Nicolas Maduro with drug trafficking.
In cooperation with the 22 partner nations, U.S. Southern Command will increase surveillance, disruption, and seizures of drug shipments and provide additional support for eradication efforts, which are going on right now at a record pace. We're deploying additional Navy destroyers, combat ships, aircraft and helicopters, Coast Guard cutters, and Air Force surveillance aircraft, doubling our capabilities in the region.
President Maduro has denounced Washington's latest move, condemning the Trump administration for accusing the Bolivarian Republic of drug trafficking.
If they want to monitor drug trafficking, they should help stop cocaine production in Colombia. Venezuela has a world record against drug trafficking. We have the world record of combating drug trafficking. If they want to stop Colombian cocaine, they need to deploy their ships in the Pacific by coming to the Caribbean, and they are letting the actual drug routes wide open.
Our correspondent Leonel Retamal in Caracas has more.
On Wednesday, Venezuela's Minister of Communication condemned the United States over deploying troops in the Caribbean Sea, near Venezuela's territorial waters. Venezuelan authorities have said the United States is putting up a smoke screen to divert attention from the Trump administration's handling of the COVID-19 crisis. Venezuelan authorities have also said they value the U.S. interest in fighting drug trafficking and that they are willing to cooperate with them. But they have also said that in order to stop drug trafficking, the U.S. should first tackle cocaine-producing areas, which are mainly located in Colombia. Meanwhile, Venezuelan authorities continue implementing measures to fight the COVID-19 pandemic.
That was our correspondent in Caracas with that report. Now, across the globe, more than 900,000 people have been infected with the novel coronavirus that has claimed almost 47,000 lives. And this has not stopped the United States from provoking and harassing Venezuela, designating the country as a state sponsoring terrorism and offering a US $15 million bounty for President Nicolas Maduro. So to speak more on this, we're joined by Italian sociologist and former head of the United Nations Drug Control Agency, Pino Arlacchi. Pino, thank you so much for joining us.
Hello, good evening, everybody.
So let's jump right into it. On March 26th, the U.S. State Department tightened its grip on Venezuela, accusing President Maduro and 14 former and current government ministers of narco-terrorism, corruption, drug trafficking, and other charges. How would you describe these indictments?
It's an absurd provocation with no the slightest relationship with the reality. Absolutely zero evidence, absolutely no coherence with what the same USA agencies of drug control are saying. If you go and see all documents of a DDA, the Drug Enforcement Agency of the United States, just the most recent one is less than 2 months ago, there is no whatsoever mention of Venezuela about drug trafficking, about organized crime, and all the rest. Everyone knows that cocaine is produced mainly in Colombia, a little more in Peru and Bolivia. Then it is trafficked to the United States through Central America and mainly from Mexico, from the Mexican organized crime, the narcos. Even babies know about narcos. Everyone knows that 96% of cocaine is trafficked from Colombia, and the rest is divided between a couple of Central American countries. That's all. Everyone knows that. In many years I'm dealing with this subject, I never heard or take into account Venezuela. I never been in Venezuela during my mandate in the United Nations. I went so many times in Colombia, Bolivia, Peru, Brazil, almost most of Latin American countries because they are in some way involved into the issue, but never been in Venezuela because there was no reason to go there. So I am simply appalled by what I'm listening about this last blow against Venezuela.
Yes, definitely. And President Nicolas Maduro, he actually spoke about that and said if they were serious about the so-called war on drugs, that they would actually take it to Colombia. And now on March 31st, the U.S. proposed that the legitimate President Nicolas Maduro step aside and a so-called interim government be installed in order to start the process towards lifting sanctions amid this COVID-19 pandemic. Would you say the U.S. is sort of using this crisis to further cripple the Venezuelan economy?
The actions against Venezuela by the United States now are very close to a genocide attempt. And I'm very serious saying that. I never used this word, it's an extremely heavy word that must be used. If you sum up all the actions that the USA government is doing since more than 1 year against Venezuela, all of these amount to a persecution that is really close to genocide. You cannot block a country on its main source of income. You cannot do a financial blockade that isolates this country from all international transactions. You really cannot destroy its currency. Bolivar has been destroyed by the United States financial mafia through this illegal website called Dollar Today that respond to a group of American financiers and to people that are very close to Wall Street. Bolivar has been destroyed and hyperinflation damaged heavily the economy of Venezuela, with the complicity of the main American rating agencies that put Venezuela's risk at the same level of Syria, meaning cutting off Venezuela from having a loan on the international market. All of this put together amount to a genocidal attempt.
Now, we know these economic blockades are sort of an invisible war. And then this Wednesday, Washington announced plans to send warships to the Caribbean Sea near Venezuela to stop illegal drugs from reaching the U.S. Would you say the Trump administration is now more than ever positioning itself for military intervention in Venezuela?
I don't think that these military provocations will end up with a military invasion. I do not think that, because the military planners and the experts, they said many occasions that would be a defeat, would be wrong, would start as Iraq, they say, and end up like Vietnam. So they know that this will not work, cannot be used, but they are used means that amount to a military invasion. These sanctions against Venezuela are killing people. Tens of thousands of people are killed by the fact that it is impossible to import basic medicine for therapies like diabetes, like many others, because international banks refuse to process the transactions related to even Venezuelans' food and medicine, which should not be included in any sanction. But they do anyway that, because they are afraid of a reaction, of a retaliation by the American Treasury.
Now, we see the timing of this taking place amid this COVID-19 pandemic, as we've mentioned earlier. And would you say that it's sort of like a smoke screen because other countries and other nations and bodies like the United Nations are preoccupied with dealing with this current threat?
The Venezuela issue has been brought to the United Nations last September, and there was a confrontation between Venezuela and the United States in terms of votation in the General Assembly of the United Nations. And the majority of the countries of the world supported Venezuela. Venezuela won the votation against the United States, who did their best to oblige many countries to vote against Venezuela. So it is not true that the actions against Venezuela are supported by the international community. Just a minority of countries is supporting the United States in these actions. Just around 50 countries out of 192 belonging to the United Nations are supporting this criminal attack against Venezuela.
Question to you, Pino, last but not least. You are in Italy at this point in time, the country with the highest number of COVID-19 deaths in the world at over 13,000 and more than 100,000 cases. How do you feel about it, and more so the government's handling of the situation?
But the Italian government is handling the situation quite effectively. Since 1 week, we have a decrease in the new cases, a decrease in people hospitalized under intensive therapy, and there is a good participation of the population accepting the lockdown and all the restrictions that have been made. So I believe that Italy, who is following the example of China, Italy will take some weeks more. China destroyed the epidemic in just 4 weeks. We will take some weeks more, but we will get out of this danger.
So much, Pino, for joining us and giving us your expert opinion on what is taking place as tensions heighten between the United States and Venezuela.
I thank you for the opportunity you gave for me to express my for the country.
That was Pino Alaki, sociologist and former head of the UN Drug Control Agency. We'll take a short break now. When we come back, an update on how the COVID-19 pandemic is impacting a couple Caribbean countries. Don't go anywhere. Welcome back. In some Caribbean news, Jamaica's COVID-19 cases have risen to 44 with 3 deaths, according to the Minister of Health. Let's take a listen.
And there are 21 females and 23 males who have been confirmed as having COVID-19 to date. In the meantime, we have 44 persons who are currently in isolation. 24 persons are under quarantine in a government facility. In addition, of course, to the 140 Cuban health professionals who are being quarantined, I think, until this weekend, when they will be allowed to engage the public health system to bolster our frontline defense.
Barbados has now confirmed 45 cases of the novel coronavirus with 11 positives in 2 days. Acting Prime Minister Santia Bradshaw advised the country's just over 230,000 citizens that drastic action needs to be taken to stem the spread of the virus.
The Chief Medical Officer has advised that the number of positive test results in Barbados has now risen to 45. That is based on a total of 382 tests conducted in the country. And just to remind you, there were 34 positive tests in Monday's update. So in just the last 2 days alone, we have recorded a whopping 11 new cases. Barbadians, 45 is too high a number. But our fear is that it will not end there. The prognosis on our current trajectory, if we do not change course as a nation, is for this number to continue to rise at an accelerated rate over the course of the next few weeks.
And Grenada, which has implemented stay-at-home measures and a curfew from 7 p.m. to 5 a.m., has confirmed 10 cases of the novel coronavirus as of April 1st.
I announced that one more laboratory-confirmed case of COVID-19 on mainland Grenada has been diagnosed. This brings the total confirmed cases of COVID-19 to 10. The individual is a 58-year-old male who arrived in Grenada from New York on March 19th. He started experiencing symptoms on March 30th and was tested on March 31st. His symptoms are currently recorded as fever, cough, and general weakness. He is quarantined and being monitored closely. There are 2 other family members in the household, and they too are under quarantine, but are not exhibiting any symptoms of the virus to date.
Turning our attention to Latin America, the Ecuadorian government has admitted that it retrieved about 150 bodies from various houses in Guayaquil, the worst-hit city in the country, but claims it does not know whether the victims died of COVID-19. The port city of Guayaquil alone has reported 2,200 cases, effectively collapsing the health system. This in turn has led to social media being flooded with images of bodies abandoned on various sidewalks and streets. In response to this crisis, refrigerated containers were delivered to the city's main public hospitals to store the bodies that have overflowed their morgues.
Honestly, it was quite odd. I didn't know what the containers were for, but when I asked, they told me it was to put the bodies in, all the bodies that are in the hospital, and that they are bringing from other places.
This is going to cause infections throughout the town, and it's going to be bad and harmful for us, the people living here. Most of us have houses made of cane, and the air comes in from even under the roofs. This is unsafe.
In Brazil, former President Luiz Inácio Lula da Silva criticized President Jair Bolsonaro in the midst of the crisis caused by the novel coronavirus, saying his actions seek to benefit banks, leaving the population without any support.
I am convinced that Bolsonaro has no psychological structure to continue governing the country. He is unbalanced, he says nothing that is coherent, and he is only concerned with keeping his fantastic happy. But he is not worried about giving answers. The people are in need of guidance. They need to receive the money that has already been approved, and he must agree that the money arrive immediately, because if that money does not arrive, we will have more confusion in the country.
Meanwhile, China has recommitted to helping Latin American and Caribbean countries, noting that it has sent its first team of medical experts to the region to assist Venezuela in the fight against COVID-19. The team left on March 29th and arrived on March 30th. At the request of the Venezuelan government, China has recently dispatched an anti-epidemic medical expert group to Venezuela after taking into account Venezuela's actual anti-epidemic needs. The Chinese expert group will also assist the Venezuelan side in improving its anti-epidemic measures and the level of treatment, and make active efforts to prevent and control the epidemic in Venezuela and even Latin America. The Asian giant has also slammed U.S. President Donald Trump's assertion that the country has misrepresented its COVID-19 figures. Foreign Ministry spokesperson Hua Chunying said U.S. politicians who accuse Beijing of concealing information are shameless and without morality. The actions and behaviors of these American politicians are shameless and without morality. We have said many times that to slander, to discredit, to blame others, or to shift responsibility cannot make up the time that has been lost. Going on into lying will only waste more time and cause more loss of life. China has done its best to be open, transparent, and responsible. Through you, Bloomberg, I want to ask these few politicians in the U.S., can you stand up and tell the world what would have happened if the country that first discovered the outbreak was the U.S. rather than China? Would the U.S. handle it better than the Chinese government? Spain has reached a grim milestone as the country recorded its highest daily death toll, taking the total number of fatalities as a result of the COVID-19 virus to over 10,000. Since the beginning of the epidemic, there have been 10,003 deaths in Spain, and the increase in the number of deaths reported yesterday to the Alert Coordination Center was 950. The United Kingdom reported on Wednesday the biggest one-day jump in coronavirus cases, prompting media to criticize Prime Minister Boris Johnson over his handling of the crisis. Our correspondent Pablo Navarrete in London has the details.
Figures released yesterday, 1st of April, by the British government show that 563 people died in a 24-hour period due to coronavirus or COVID-19, which is the biggest amount of deaths since the reporting began. Now, this takes the number of people in the UK who have died due to the virus to 2,352, and it's growing at an exponential rate now. Some have argued that it's showing a larger amount of deaths at this point than Italy had at the same point. Now, the British government has increased its popularity in the polls, according to some pollsters, although yesterday saw the first time that it was criticised in various newspapers for its strategy on how to deal with the virus. Now, initially, as we know, the British government seemed to be pushing for herd immunity, letting the virus spread amongst the population. This has changed, although a clip yesterday on the BBC went viral, showing a BBC presenter showing surprise at the fact that the government had announced only 30 ventilators would be ready for this weekend, when it has said that 30,000 are needed to deal with the pandemic. So the British government seems to be coming under increasing media scrutiny over how it's dealing with the crisis, and the number of deaths in Britain is going up at an alarming rate.
Our correspondent Pablo Navarrete with that report. The European Union has pledged to raise up to $109 billion in loans to mitigate the economic impact of the coronavirus crisis in the bloc. The loans should be backed by 25 billion guarantees committed by member states to the EU budget.
And this is why we introduced today's SURE. SURE is Europe-supported, short-time work. It can mitigate the effects of the recession. It keeps people in work. It enables companies to return to the market with renewed vigor. The Commission will provide loans to those member states that need them to strengthen their short-time work schemes.
The EU chief also expressed great concern over a coronavirus emergency law in Hungary that has given far-right Prime Minister Viktor Orban sweeping powers with no end date.
And I understand that member states may need to take emergency measures to address the immediate health crisis. But I am concerned that certain measures go too far. And I'm particularly concerned with the situation in Hungary.
And we end with news in Russia. The country has extended its no-work order until the end of April to combat the coronavirus crisis, as the nation registers over 3,500 cases.
I've taken a decision to extend the period of non-working days until April 30th. I emphasize employees will keep receiving their salaries.
And with that, we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. For our viewers in Africa, remember you can find us on Starsa Channel 461 in South Africa and Channel 539 in Nigeria. And join us on social media for Telesur English. I'm Doris Polo. Thanks for watching.